Dr. Tahani Zaidi, and previously we talked about what is maternal sepsis, what are the associated risk factors, and then how can it be managed on a community level or on a healthcare system level. But today we are going to talk about what to do as a researcher for maternal sepsis. And for that, we again have the master with us, Dr. Sheikh Irfan. I'm very excited. Welcome again.
Thank you for having me again.
So let's just start with the conversation. We previously talked about maternal sepsis, the risk factors and everything else about it, the basic knowledge. But today, let's just kick off with the question that how much the whole world has researched about maternal sepsis.
So for decades, research has primarily focused on other leading causes of maternal mortality that are postpartum hemorrhage, hypertensive disorders leading to significant improvement. However, maternal infections and sepsis remain critical issues. So modeling studies till date suggest that around 17,000 maternal deaths occur worldwide due to maternal sepsis. And the key gaps that exist in the care of these cases were identified by Sierras et al., which include failure to diagnose sepsis, to initiate early treatment, and the involvement of multidisciplinary team. WHO emphasizes on proper infection control and early diagnosis and treatment to prevent its occurrence and the further complications of maternal sepsis. The interventions like proper antibiotic usage, patient care, bundle tools, triggered tools can reduce the risk of maternal sepsis, but data is lacking on their implementation, especially in low resource settings. So GLOS, or Global Maternal Sepsis Study, found out in their population that only 1/3 of the women received antibiotics for the management of maternal sepsis, or they even didn't have the vital signs recorded at all, which is very alarming.
Yeah, that is like very alarming. And even though the research is limited, but the findings are still very worrisome. But you know, we know the reasons, we have researched it and all of that. What is the global impact of the existing literature, of the existing research that has taken place? What has been done after this research?
So there are limited pregnancy-specific evidence-based guidelines to treat maternal sepsis. So effective interventions like early warning scores, patient care bundle tools, and best methods to prevent and treat maternal sepsis, and obviously the data on their implementation, implementation of evidence-based strategies, especially in low resource setting, is lacking. And however, few early attempts have been made to develop patient care bundles for sepsis patients, but they were not broadly utilized or adjusted for obstetric population. So the development of maternal sepsis bundle is a global priority.
Okay, and so we discussed it in the previous podcast as well, that the numbers are very high for the lower middle income countries, and the things that you are telling are also are representing that it is a worrisome condition especially for lower middle income countries. We have stressed that enough. So in terms of research, how can developing the capacity of research or strengthening the research capacity in lower middle income countries will benefit these developing nations and lower middle income countries?
So strengthening the capacity in maternal sepsis research benefits developing countries as well as high-income countries by providing evidence-based strategies to early diagnose and treat maternal sepsis. WHO recognized the need for the evidence renewed focus of evidence synthesis to support effective interventions which would benefit both the developing countries and the high income countries.
Okay, so as a junior researcher myself, I think there might be a lot of them out there who would be, I hope so, after listening to this podcast, would be interested in researching about maternal sepsis. Though there's a very limited literature that you said we have right now for maternal sepsis, so how can a young researcher research on maternal sepsis, and what are the points or what are the research gaps that needs to be addressed and a young researcher can start researching about them?
So the key gaps exist in maternal sepsis research is the lack of data on the actual number of suspected and confirmed sepsis cases, the primary causes of infections, mainly in low resource settings, their risk factors, and the best treatment and preventive methods. And also there is lack of evidence on the implementation of evidence-based strategies in the low resource settings. And a valid standardized diagnostic criteria is required to identify severe maternal infections, and early warning scores like Muse charts needs further validation in low resource settings.
So this brings me back to my favorite question and my very anticipated question. Please tell us about your work. We need to know about that.
So our research primarily focus on improving the prevention and management of maternal infection and sepsis. We implemented fast M intervention in a large public sector healthcare setting. The intervention included screening tools, like Muse chart for screening sepsis patients, and then decision tool to guide on to identify suspected and confirmed sepsis cases and to guide on further management. And then a patient care bundle. So the patient care bundle includes, that's fast M, that includes the guide that gives guidance on administration of fluids, antibiotics, ideally within first hour of diagnosis of sepsis, and then controlling the source of infection, transport when needed, and ongoing monitoring of mother and neonate. So the intervention also included training of health care providers on the use of these tools. So following the intervention, we found that 70.5% of women received all components of fast M bundle within 1 hour of diagnosis of sepsis. We also found that there was 9.4% reduction in the mortality of the maternal sepsis cases in the facility. So based on this, the hospital administrations decided to include these tools in patients' file for ongoing monitoring and management of maternal sepsis patient, which we believe is a major achievement of our work.
That's amazing. However, I would like to ask you, what was the duration of the whole intervention?
It took us whole year.
It took you
The
whole
actual
year.
intervention was for 6 months, and there was a baseline period in the beginning in which we just assess the ongoing practices and the intervention, and then there was a period in between for the trainings and then the actual intervention period.
So you said that the hospital administration agreed to, incorporate your bundle into their daily routine care. I would just deviate and ask you, what were the challenges in implementing this intervention? What was the main challenge that you faced and you overcame? Because dealing with hospital administrations, I think, is a very difficult task.
So I must say there is a long list of challenges whenever you are introducing any new intervention, and especially in public sectors. So especially in obstetrics and gynecology, it's very, first of all, reaching out to them and making them understand the benefits and the necessity of introducing, because they just want to stick with their ongoing practices and guidelines. First, the making them realize what's the current situation is, and then this was the first major challenge we had. And then so when we started this work back in 2020, and then we had this COVID pandemic thing, and so things got delayed, and then there were we really struggled a lot with especially the training part, making them sit together and learn the methods of how to use these tools. So that was another challenge we had. And then I think the other challenge that actually we face at the time of recruiting patients, because majority of patients were ending up because at that time there was a COVID upsurge, and our sample included all patients with the signs and symptoms of infection, and most of the patients were ending up had the COVID, and then the COVID testing was not readily available. So we really struggle to rule out this, the COVID symptoms with the other, causes of sepsis. So this whole thing was very challenging. The whole process was very challenging.
I'm glad that you made through it, and I think the results are pretty amazing. I hope it gets implemented throughout the Pakistan, because there's a lot of evidence. It is a substantial evidence that came out. Brings me to my next question. If someone wants to implement what you have done, so how they should go about it? Like if they want to implement FastM into their settings, which is very similar to ours, so how they should go about it?
So we believe FastM can be an integrative approach to improve the prevention and management of maternal sepsis and in low resource settings. Further work is still required to improve its execution and to assess its impact on clinical care and patient outcomes. So our next aim is to trial this intervention across Pakistan and possibly other low middle income countries. Another multi-center large trial, that's Sepsis, underway in Malawi and Uganda to more robustly assess the effectiveness of FastM on a larger scale, and this will add further information on implementation at scale. And we believe to maximize the coverage and to improve the sustainability, there has to be a rigorous adjustment process with the wider involvement of practitioners involved in patient care and alongside the patients. And then these interventions, their implementation should be based on the careful assessment of the existing resources. So that's
what one should do. Yeah. Thank you, Dr. Sheikh Irfan. Thank you for coming again, and thank you for sharing, telling us about your wonderful work that you're doing. And I hope that you still continue to do it. And I hope you meet an army of young researchers along with you, and people get inspired from your work and continue to do so in advancing the research for maternal sepsis. So thank you again for coming, and it was lovely having you.
Thank you.
Thank you for listening to us and tuning back. We hope that you're equipped with all the knowledge related to maternal sepsis. I had a good time in the conversation. Until next time, this is your host signing off. Take care.